Hello, and welcome to today's edition of GP Notebook podcasts. My name is Dr. Hannah Rosa. I'm a GP working in the northeast of England and a member of the GP Notebook education team. Join us for a whole range of bite-sized topics tailored for those working in primary care, perfect for your daily commute or when you're out on a morning stroll. You can tune in to us on all leading podcast platforms, and don't forget to like and subscribe so you don't miss an episode. And if you enjoy what you hear, please consider leaving a review. You can stay connected with us on X at GPnotebook for podcast updates and much more. Lastly, check out the new GP Notebook website for podcast show notes with additional resources and to register for study groups. Now, let's get started. In this episode, we will be discussing young people and their changing relationship with alcohol. During my clinical work over the last few years, I have noticed that more young people are informing me that they don't drink at all. Alongside this, I've also spotted more media headlines highlighting that young people in the UK are turning away from alcohol altogether. This then got me thinking, are young people today really drinking less alcohol? And if so, what is behind this trend? Or are the headlines not telling us the full story? And is alcohol misuse still a concern? We will also explore the latest research looking into the dangers that alcohol can cause to young people, before finally considering how we, working in healthcare, can assess and help our adolescent patients who are drinking risky amounts. First then, let's look at alcohol use in young people and how this has changed over recent decades. From 2003 to 2014, NHS Digital recorded a steep increase in pupils aged between 11 and 15 who reported having never drunk alcohol. The results noted a rise from 39% to 62%. In 2016, they changed the wording of the questions that they asked pupils, so we can't directly compare these figures to later results. In 2021, NHS Digital asked pupils aged between 11 and 15, using the newly worded questions about their alcohol consumption. As a percentage, how many do you think said that they had never had an alcoholic drink? The answer is 60% of pupils, an increase from 56% in 2018. Whilst this is very positive, let's not forget that this means that 40% of 11 to 15-year-olds admitted to having drunk alcohol before. And when we look at the data more closely, it reveals that 9% of pupils said that they'd had an alcoholic drink in the last week. There was also wide variation across the different regions of England noted, with London having the lowest rate of drinking in the last week at only 3%, and the South West the highest at 12%. I feel that it's also worth highlighting that of the 9% of pupils who had drunk alcohol in the last 7 days, they consumed an average of 8.9 units that week, with 18% of them having drunk more than 15 units, thus exceeding the recommended weekly total for an adult. In 2023, DrinkAware published a report entitled The Sober Myth: Are Young Adults Really a Generation of Non-Drinkers? They surveyed more than 5,200 young adults aged 18 to 24 from across the UK between 2017 and 2023 and found that more are choosing not to drink, with a rise from 14% in 2017 to 21% in 2023, and that young adults are more likely to be non-drinkers compared with the rest of the adult population. However, they also found that those who do drink are more likely to binge drink and drink at high risk or dependent levels compared to drinkers aged 25 and over. Young adults are also more likely to suffer from memory loss and depression linked to their drinking. So, whilst the media headlines often focus on the abstinence rates, it's important to recognise these other, more worrying trends amongst young people and young adults who are still drinking. So, next let's think about why more young people and young adults are not drinking alcohol. In 2023, research was published showing the explanations that young people aged 12 to 19 in England gave when asked about this trend. They included that young people are now more aware of the potential risks of alcohol to their physical and mental health, both in the short and long term. That the growth of social media has had an effect, as young people don't want to have photos or videos of them drunk shared online. That alcohol is too expensive, especially with the current financial worries affecting many. And that there are stricter regulations in place, for example, Challenge 25, which is a retailing strategy that encourages anyone who looks under 25 to carry acceptable ID to purchase alcohol. At this point, I feel that it would be useful to sidestep slightly and remind ourselves of what the law states. Across the UK, if you're under 18, it's against the law for someone to sell you alcohol, for you to buy or try to buy alcohol, for an adult to buy or try to buy alcohol on your behalf, and to drink alcohol in a licensed premises, like a pub or restaurant. However, if you're 16 or 17 and accompanied by an adult, you can drink, but not buy, beer, wine or cider with a meal. So, if it was New Year's Eve and your gran gave you a sip of champagne when you were 12 years old, would you have been breaking the law? Well, in England, Scotland and Wales, it's not illegal for someone between the ages of 5 and 17 to drink alcohol at home or on another private premises. But it is illegal to give alcohol to children under 5. So, Gran is safe, as long as she didn't give any to your 4-year-old sister. Looking at this alone then, you could conclude that the government is happy for children 5 and over to drink alcohol as long as they're on a private premises. However, in 2009, the first official guideline on alcohol aimed at children and young people from the Chief Medical Officer for England was published. In this, an alcohol-free childhood is advised as the healthiest and best option. And this is the key message that we need to be telling the public. And personally, I wish that the CMO had stopped there, just with the emphasis on an alcohol-free childhood. But the guideline continues, saying that if children do drink alcohol, then it should not be until at least the age of 15. And then it should always be with the guidance of a parent or carer or in a supervised environment, and it should certainly be on no more than 1 day a week. The guideline emphasises at this point that parents and young people should be aware that drinking, even at age 15 or older, can be hazardous to health, and again relays the message that not drinking is the healthiest option for young people. So, next let's focus on what the risks of alcohol are to young people. Why is an alcohol-free childhood the best option? Well, there are many potential harms which alcohol in childhood can bring. To start with, it increases the risks of accidents, injuries, and being a victim of an assault. Research has suggested that it plays a role in more than 50% of traumatic brain injuries in adolescents, and it has been linked to 80% of adolescent deaths from homicides, suicides, and unintentional injuries. Intoxication also often occurs more rapidly and by surprise in teenagers, due to physiological factors such as their smaller frames, and socio-cultural factors such as a lack of experience on the effects of alcohol. Alcohol also increases the likelihood of being involved in other risk-taking behaviours, including smoking, taking illegal drugs, and antisocial and criminal behaviour. In terms of physical health, a review published in 2008 found that adolescents who misuse alcohol are more likely to suffer from appetite changes, weight loss, eczema, headaches, and sleep disturbance. Further research has also found that adolescents who drink heavily may experience some adverse effects to their livers, bones, and on their growth and endocrine development. Alcohol consumption before 18 can also affect children's moods and mental health. Alcohol has been shown to increase feelings of stress, anxiety, low self-esteem, low motivation, and depression. It can also lead to a negative relationship with alcohol in the future and poor coping mechanisms. The research that has had the biggest impact on me, though, is the growing body of evidence highlighting the dangers of alcohol to the developing brains of young people. We now know that the brain is not fully developed until a person reaches their mid to late 20s, and that alcohol, as it is a neurotoxin, may disrupt or even damage the essential rewiring and recoding that the brain goes through to allow teenagers and young adults to develop more specialised skills and thought processes. DrinkAware commissioned a review of the impact of alcohol on brain development in adolescence. They found that overall, young people who drink alcohol show regional differences in brain structure compared to young people who don't drink alcohol. For example, they had smaller grey matter volumes and lower white matter integrity in relevant brain areas. Adolescents are also more vulnerable to both subtle brain damage and long-lasting cognitive deficits following alcohol exposure, especially in the emerging brain faculties of executive functioning and long-term memory. They also concluded that young women may be more vulnerable than young men. Now, I have often heard it said that in other countries, such as France, they have a better approach by introducing alcohol early in the home, so their children grow up knowing how to drink sensibly. However, researchers have shown that parents who supply alcohol, even with the best intentions, are likely to accelerate their child's drinking, and that early initiation of alcohol use is associated with an increased risk of alcohol-related harms and dependence. Studies have shown that a person is 4 times more likely to become dependent on alcohol if they start drinking before the age of 15 compared with those who wait until the age of 21. The reasons for this are in part due to how our brains change as we mature. Teenage brains get a greater high from the dopamine released when alcohol is consumed compared to adult brains. This may lead to the brain developing an increase in reward responsiveness to dopamine, making addiction more likely in the future. Another factor that puts adolescents at greater risks from alcohol is that their frontal lobes don't start maturing until they're around 16 and don't finish maturing until they're in their mid to late 20s. This results in teenagers having a reduced ability to control their impulses and make good, less risky decisions. This is also linked with why alcohol consumption is associated with increased risks to sexual health. Adolescents who drink alcohol have an increased likelihood of having sex at a younger age and of having unprotected sex, with the associated potential consequences of unplanned pregnancies and STIs. There is also evidence that alcohol use can have a detrimental effect on young people's short-term educational performance, as alcohol consumption in the evening may affect a child's performance at school on the following day, and can result in students being more likely to miss classes. A longitudinal study from America followed children from the age of 13 for 10 years and found that early drinkers and experimenters are more likely than non-drinkers to report academic problems, and in young adulthood to have employment problems. Now, a common concern from parents is that if they forbid alcohol use, it will only make their teenager want to drink more. However, parental disapproval is one of the key reasons children give for their decisions not to drink. To further support this, a report published in 2022 by NHS Digital found that the strongest factor associated with pupils having had an alcoholic drink within the last week was, want to have a guess? Having parents who don't discourage alcohol. They also found that when they asked pupils where they had obtained alcohol from in the last 4 weeks, 75% of them said, that's right, that they had been given it by parents. So, a key message from the research has been that home is largely where young people learn to drink. There is therefore the need to educate parents on the risks of underage drinking and on the impact that, as parents their own behaviours can have on their children. For example, if a child sees adults regularly enjoying alcohol, then they are more likely to develop positive ideas and attitudes around it, and this can start from as young as 4 years old. It is therefore important for children to see adults enjoying themselves without alcohol, not having alcohol as the focus for all social occasions, showing they can refuse a drink, and choosing to have alcohol-free days. It is also important to be aware of the way that we talk about alcohol in front of young people. For example, saying, "I've had a hard week, I need a drink," can send the message to a child that alcohol is a good way to cope when things are tough. It's important instead that parents are encouraged to have meaningful conversations with kids about the risks and dangers of alcohol, as this has been shown to help children to develop a sensible relationship with it. I've put a link to a few really good resources that can help parents and carers to do this in the resources section of the show notes. I'd next like to focus on when, as healthcare professionals, we should ask young people about their alcohol use. Public Health England, together with NHS England and Health Education England, encourage us to use the Make Every Contact Count approach. This aims to encourage everyone working in health and social care to use the interactions that we have with people to support them to make positive behaviour changes to benefit their physical and mental health and well-being. Reflecting upon our day-to-day clinical work then, most of us would routinely ask an 18-year-old who was struggling with their mental health about their alcohol consumption. But would we ask a 13-year-old or even a 15-year-old who had had the same struggles? Given that 4% of 13-year-olds and 20% of 15-year-olds admitted to drinking alcohol in the previous week when surveyed by NHS England, then I would argue that we should be asking adolescents about alcohol use more routinely, and not just in relation to mental health problems. As we have discussed, alcohol is also linked to a wide range of physical health complaints, injuries, sexual health complications, other high-risk activities and future problems, then we should be asking our young people about their alcohol intake more routinely. Further supporting this, research has shown that early drinkers do not necessarily mature out of problematic drinking, and so the sooner we can identify those that need help, the better. The next topic that I'd like us to consider then is how we can decide if a young person warrants interventions to help with their alcohol use. And here the good news is that, just as with adults, the Audit C and audit screening tools have been validated for use with adolescents to screen for harmful alcohol consumption. I'd just like to highlight a few things though. Firstly, that the thresholds for which intervention is recommended for young people differ compared with those used for adults. If on the 3 questions of Audit C, a young person scores 3 or more, then alcohol brief intervention and information about specialist alcohol services is advised. If they score 6 or more, then a formal referral to a specialist substance misuse service is recommended. When all 10 audit questions are completed, then a score of 5 or more suggests problematic alcohol use in young people. The second point that I'd like to highlight is that ideally children should not be consuming any alcohol at all. So a young person may not disclose the true amount that they are drinking due to fear of the consequences. And lastly, please note that using Audit C and audit alone will not give you the full picture. So just be aware of other vulnerabilities which may be present, which can put a young person at greater risk of harm. These vulnerabilities can include factors such as drinking at a very young age, or if they or others around them are misusing other substances, if they aren't in education or training, if they have mental health concerns, or if they're already on a child protection plan. Therefore, if you have any concerns about a young person who has drunk alcohol, then specialist youth services will be more than happy to see them, regardless of their audit score. If you are concerned about alcohol dependency, if the young person has compulsive drinking, increasing tolerance and withdrawal symptoms, then as well as being referred to a specialist service for alcohol support, they should also be advised not to drive or to stop drinking suddenly. Thankfully, this is rare in young people. In many areas, the alcohol support service for young people will be run by the same organisation who support adults. However, in some parts of the country, it is managed by a completely different company. So, if unsure, just double check what the provision is for young people where you work. Many services also have a member of staff on duty who can take calls during working hours. So, if you're unsure about the best course of action for a young person, please contact them. Also remember that young people who enter specialist services for drug and alcohol support often have a wide range of problems or vulnerabilities, for example, being a victim of sexual or criminal exploitation, or being affected by domestic abuse. So keep your safeguarding hats on when it comes to these young people, as sometimes a referral to social services or even the police will be necessary. In summary then, the good news is that more teenagers and young adults are abstaining from alcohol. However, those who do drink, we now know, are more likely to suffer with problems with alcohol misuse and dependency in the future. There is also a growing bank of research indicating the harms that alcohol during childhood can cause, especially in the developing brain, which could potentially prevent a young person from reaching their true potential. To help these young people, it is therefore vital that we educate parents and carers about the dangers of alcohol, inquire about alcohol use when seeing young people in clinic, and offer the appropriate support when necessary. Thank you all for listening. I hope that you found this podcast helpful and that you've learned a few extra nuggets of information. As always, all the links to the resources that I've mentioned will be in the podcast notes at GPnotebook.com. And we'd be very grateful if you would consider following the podcast and leaving us a review on your favourite podcast platform. Feel free to get in touch via social media at GPnotebook or email support@GPnotebook.com if you have any questions, comments or ideas for future podcasts. You should also visit us at GPnotebook.com to register for our virtual GP Notebook study groups and to download free shortcuts to help improve the lives of our patients in primary care. Right, I'm off to start a new campaign promoting an alcohol-free childhood. I'm going to go with Just Say No, Nancy Reagan style. Goodbye.